Following a surgical procedure in the OR, instruments are taken to the soil zone to start the instrument decontamination process. In the instrument decontamination process, the instruments follow the manufacturer's IFU along with local guidelines and protocols. If the instrument is too soiled, the manual cleaning takes an action, or some IFUs also recommend the manual cleaning before the automated process. Before the instruments are transferred into the clean zone, they typically are processed through an automated process, such as Washer-disinfector or ultrasonic cleaner. Advised as a daily routine, wash monitors provide independent verification that the cleaning process is consistently providing the desired cleaning result, such as the removal of blood components and microorganisms. Instruments may look clean, but we have to consider whether visual verification is good enough. Sometimes it's not. Debris not removed in the washing process will not be removed during the sterilization process. Surfaces used in the soil zone may also be contaminated. Residual contaminants or soils left behind on instruments, scopes, inside cannulated items, washer-disinfector and ultrasonic cleaner control panels, or other surfaces can lead to infections. Getinge Assured Protein Test is easy to use and provides assurance that the surfaces and the instruments are free of residual proteins. Instruments can carry the residual proteins and be permitted to pass into the next phase of the process. In summary, visual inspection isn't always enough. Getinge wash monitors are designed for monitoring clean efficiency during the washing process. This minimizes the risk of process errors, which can lower the risk of spreading infection in the healthcare environment. Effective cleaning may result in improved patient safety and reduced cost for healthcare facilities.